Hello, dear colleagues. I'm glad to present you results of our research enhancing healthcare provision in conflict zones, queuing system models for mobile and flexible medical care units with a limited number of treatment stations. The research is done in collaboration of Byketov National University of Urban Economy in Kharkiv and National Aerospace University Kharkiv Aviation Institute in Ukraine. On February 24th, 2022, a full-scale invasion of the Russian army began a new stage of Russian-Ukrainian war, and this is a people's war for the independence and sovereignty of Ukraine, which has gone on since 2014. It's also a war for civilizational choice. Ukraine defenders its belonging to the European civilization, and at the same time those basic values, rights, freedoms that underlie the Western world. Russia's war in Ukraine has brought huge casualties among the civilian population and destruction of infrastructure. The health infrastructure suffered due to the destruction of hospitals, the lack of medical personnel, the need to reallocate resources to military tasks. In the context of healthcare services provision during the Russian war in Ukraine, the efficient and timely delivery of medical care to affected population is on utmost importance. Healthcare systems in war-torn areas face numerous challenges, including the destruction of infrastructure, shortage of medical supplies, and limited access to trained personnel. To ensure the high quality and availability of healthcare services, it's necessary to address various technical and organizational problems while considering a multitude of factors. One of the critical components of a healthcare system in such circumstances is establishment of a mobile and flexible medical care unit, or MFMCU. An MFMCU is a modular and dynamic system composed of portable medical facilities, equipment, and personnel that can be rapidly deployed and reconfigured based on the evolving needs of the conflict zone. The design and implementation of an MFMCU requires significant investment, but its highly adaptability and responsiveness can significantly improve the healthcare outcomes for the affected population. And to optimize the MFMCU's performance, a systematic approach to planning, designing, and managing its components is essential. Modeling can play a crucial role in this process by allowing the simulation of various scenarios and the assessment of the system's performance under different conditions. This enables the identification of potential bottlenecks, resource allocation issues, and other challenges that may hinder the effective functioning of the MFMCU. The development of an MFMCU relies on a multidisciplinary approach encompassing various fields such as public health, logistics, and communication system. A key element in the design of an MFMCU is the establishment of an efficient and responsive logistic network that can facilitate the movement of medical supplies. Requires the development of a queuing model that accounts for the stochastic nature of the demand for healthcare services and the unpredictable nature of the conflict. The medical logistics system uses different types of transportation, such as ambulances, drones, or trucks, to transport patients, medical supplies, and equipment between different MTS and other healthcare facilities. For each request from an MTS, the medical logistics system performs several cycles depending on the specific requirements of the patient and availability of resources. And given the specific functioning of such systems, there arises the task of developing a model of queuing systems for the MFMCU. In this model, the role of a service device is performed by the medical personnel at the MTS. A finite number of MTSs act as a source of requests for healthcare services. And for each request, the medical logistics system performs several service cycles. This model enables the optimization of MFMCU performance by identifying potential bottlenecks and ensuring the efficient allocation of resources, ultimately enhancing the provision of healthcare services in the war-torn regions of Ukraine. By addressing these challenges and leveraging the insights gained through modeling and research, it's possible to design an effective and resilient MFMCU that can provide much needed healthcare services to the war-affected population in Ukraine, ultimately saving lives and improving the overall healthcare health outcomes. Therefore, this paper aims to develop the model of mobile and flexible medical care unit at the level of the service site. So let lambda be the intensity of requests from MTS, the number of which is equal to n, and r is the average processing time of one cycle. Then mu is intensity of service of one cycle, and m is intensity of service of the whole patients from MTS. Assuming Poisson event flows, we will develop and study a mathematical model of this MTS, which will be a single-line queuing system with a finite number of request sources and multi-stage servicing of each request. We will carry out research for stationary state and denote by Q0 equals P0 the probability of idle of medical personnel when they are not providing any medical service. PI is a probability that IMTS have sent requests for medical service. One of them is serviced by by medical personnel, and the rest waiting in a service. And Qij is the probability that the IMTS have sent medical service request and the medical personnel is working out the YOTS cycle. So we denote by Qij the probability of the joint occurrence of two events. First one is an arbitrary moment of the equilibrium state of the MTSs. I request for medical service were sent, and the medical personnel completes the YOTS task. And the second, the time during which the current task continues is contained in the interval as the stationary probability densities of the fact that an arbitrary moment of the equilibrium state of the MTSs, I request for the medical service were sent. The medical personnel fulfills the YOTS task, and the time during which this task continues is equal to U. It's assumed that this value is continuous. So the quantities under consideration of the interconnected by the following relationship, which is shown on the slide left, and considering the possible states of the system in an arbitrary small time interval with subsequent passage to the limit, we obtain the following system of equation. It's shown on the right. So the probabilities of the states for the case when the time during which the service continues is not taken into account are Q0 and Qij. The sum of the probabilities is equal to 1 as a boundary condition have the form as a formula on the slide above. And similarly, the following equations are true. So the system of equations as a mathematical model of medical treatment stations at the level of the production size. To solve system of equations, we use the methods of discrete binomial transformation, which along with generating functions are used to reduce differential difference equations to simpler one. Let us introduce discrete transformation, which is shown on the slide, where IM is binomial coefficient equal to 0 at I less than M. After transformation, we write the equations as in the left part of the slide, and let us multiply both parts of the is equation of the system by I-1, 0, and the last equation of the system by n-1, 0, and we will obtain the following formula, which is on the right on the slide. So taking into account that I0 equals to 1 for the right parts of the equation of the system, we make this substitution I-1, 0 equals to 1-2, 0, except for the last equation, and sum the left and the right parts of the equation of the system. And using discrete binomial transformation, we can transform the equation. Let's derive an expression for Vm1. And to do this, let's write the equation included Vm1 0 in the system of equation, which is on the left. After the transformation, summing up the left and right part of the equation of the system, we finally obtain the formula on the right side on the slide. After the transformation, using the recurrent properties of the expressions, we obtain the following expression, where delta yi is a Dirac function. So let us use the fact that Vn-1c equals to n-1 lambda plus mu Vn-1c, and we rewrite the expression for Vmc0 in the form which is presented on the slide. Yeah, and after the transformations, we receive the following expression, which is shown on the slide in the bottom, and using the normalization conditions, we obtain an expression for the downtown probability Q0, which is shown on the slide. Using the obtained expressions, it's possible to find the main characteristics of the studied MFMCU. And medical personnel load factor is Z equals 1 minus Q, and the cycle of work MTS as T consists of the processing time of the next part 1 divided by lambda, after which a request of the medical personnel is formed, and the time in system R that is T equals to 1 divided by lambda plus tau. Then the utilization rate of the MTS is shown on the slide. The average number of the idle medical personnel, the average downtime are determined by expressions above, and the numerical analysis shows that for the given parameters, number of service cycles for one request from MTSs should not exceed 2. With those parameters, the characteristics of the MFMCU remain acceptable. So this paper proposes the application of the closed queuing model with a finite number of treatment station and multi-phase service as a model for MFMCUs in conflict zones. Under the assumption of Poisson event streams, a system of integral differential equations for the probability densities of the introduced states was developed. And to solve it, the methods of discrete binomial transformations is employed in conjunction with production functions. Solutions were obtained in the form of finite expressions, enabling the transition from the probabilistic characteristic of the model to the main performance metrics of the MFMCU, the load factor of medical personnel, and the utilization rate of treatment stations. The result shows a selection of the number of treatment stations in the medical care area and the calculation of the appropriate performance of medical personnel. Thank you for your attention.